Hey everybody, Dr. Rob Silverman here, Facebook Live. It's a pleasure to be here. Excited to share some really interesting information with you all. Um, a lot of things going on in the news, obviously. Really want to talk about health. I want to talk about the thing that's in the news more than anything. And without question, and that is, the health pandemic, the COVID-19, SARS-CoV-2, etc. And I want to talk about it because I was at dinner with a good group of friends, and a lot of them ask the question, is it a flu? Is it not? And the information indicates that it's not a flu. There's more involvement than a flu. So a lot of people are asking about the antibodies. Do they last? The vaccine, the infamous vaccine. What natural things can you take? So I figured it'd be a great time to grab the proverbial bull by the horns and let's do some updates on the health pandemic, and especially updates on the perspective idea of autoimmunity within the health pandemic. So let's talk a little bit about COVID-19, children, and antibodies. Children affected with coronavirus produce actually weaker antibodies and fewer types of them than adults do. Weaker immune response in children may paradoxically indicate that they vanquish the virus before the chance to wreak havoc in the body. This all really truly helps explain why children mostly are spared severe COVID symptoms. Why they are less likely to spread the virus, it's very interesting. The children under 10 essentially make primarily IgG. Now, there's three types of specific types of antibodies. There's IgG, there's IgA, and there's IgM. I didn't include something called IgE because that's a quick allergic reaction, and that's not going to occur when you're encountering this type of pathogen, this type of virus. IgG is the most common. It's the longest lasting. IgM is something that's earlier. Probably you're going to see it in the first 7 to 14 days. And IgA, you're really not going to test for it. It's more what we call a secretory immunoglobulin antibody that you're going to see more at the time if there's damage to the gut or damage to the lung. So a big takeaway here as we get into this concept is COVID-19 is not a lung disease. It is a blood vessel disease. So adults make different antibodies. So the real difference, interestingly enough, is the IgG for the children, it can pass the placenta, recognizes what we call the spike protein on the surface of the virus. So here's the protein, and here's the spikes. So the spike, it's a triple layer, boom, gets in there and sticks in and goes. And that's what happens to the children. They understand that it enables you to block, that antibody blocks the surface of the virus. Adults are very interesting in that they have the IgG, IgA, and IgM, so they have a much stronger antibody effect or response, if you will. In addition, the children only have what we call the S protein. When you look at that corona, that whole protein, there's an S and an N protein. The adults have the N protein, and essentially what I'm saying is part of the reason why children have a much lesser response is because they're getting the main antibody, which IgG is the most effective. The reason you have the antibody is actually to dock and block the ability to spike the protein and spiking the S. Whereas the adults, they have much more aberrancy in their antibodies. So let's look at COVID-19 and autoimmunity. Autoimmunity means you attack yourself. Your body's immune system gets confused and it begins to attack itself. That poses a major issue. So for me, when patients come in on a multitude of things, I'm always trying to evaluate to manage and modulate their inflammation, because if their inflammation runs rampant, their immune system will act aberrant and therefore start attacking itself, and that's called autoimmunity. In a study at the end of October of this year, 52 patients were studied with COVID-19. 44% of them had a positive, what we call ANA. And that ANA is an inflammatory marker. 19% of them had a positive rheumatoid factor. So believe it or not, 19% had rheumatoid factors. 59% of the ANA patients had at least one other positive autoreactive antibody test. 70% of patients had a high C-reactive protein group that showed either high ANA or rheumatoid factors. So what we're saying is patients with COVID, the positive people that had COVID, had high levels of autoimmunity proven on blood tests. So this is where it really differs. This is where it differs. Here's the deal. I'm repeating myself, I know. Here's where it differs from a flu. Autoimmunity poses an issue because it's very deleterious to overall health. It can damage your joint. It can damage your brain. People have come into my office and lost their hair. So let's talk about some robust neutralizing antibodies to SARS-CoV-2 infection, which has been persistent for months. Over 30,000 people in this study were positive for COVID-19. This study was done from March to October in 2020. It was done and recorded and assessed at the Mount Sinai Health System. So Mount Sinai is a huge, very reputable hospital in New York City. Here are the takeaways. Vast majority of infected mid to moderate patients mounted a robust antibody response that was stable for at least 5 months. More than 90% of them had strong enough response to neutralize the virus. So this whole idea that your antibodies aren't working, your body's immune system wasn't able to kill it, is incorrect. There's more problems within that, but the idea is the antibody response correlated with the ability to neutralize the virus. So the majority of these patients were able and stable. So we're not losing the antibodies quite as quickly. It's not going up and quickly going down. It's going up, staying, and slightly, not precipitously, but slightly decreasing in their drop, just like it's supposed to work. So yes, you are susceptible to a second attack. So those people have the antibodies, could conceivably still get it, but probably over a longer duration of time. In another study in October of 2020, COVID shifted from the B cell activation, I'm going to explain this, in germinal cells within lymph node follicles to extrafollicular B cell activation. So what do I mean by that? Germinal cells in the lymph nodes actually have their own ability to slow down and help with the amelioration of the virus via those B cells. The extrafollicular B cell activation is one that's racing to get there, the one that is immature. Its immaturity leads you down a path of issues because it does not understand how to positively affect the virus. So the takeaway in this study was extrafollicular cell immaturity may yield more autoreactive B cells. Because it's not mature, it doesn't die off. And by not dying off, it actually adversely affects other cells and starts to attack yourself. COVID-19 autoantibodies. It's misguided immune response. So this misguided immune response, autoantibodies, may explain why people are long haulers. They've got coughs for 3 or 4 or 5 months. These patients actually produce what we call autoantibodies. This is very reminiscent of 2 autoimmune type conditions called lupus and rheumatoid arthritis. In this study, 52 patients from the Emory Health System had severe critical COVID-19. These patients had no history of autoimmunity. Half of them had autoantibodies. Some autoantibodies are associated with blood flow problems. So the attack to the vascular system is an autoimmune response. Remember, COVID is not a lung disease. It's ACE2 receptor site disease, which affects adversely blood flow and blood vessels. So COVID-19 has also been shown to damage the frontal lobe of the brain. 15 to 25% of patients with COVID-19 may experience neurological symptoms like headache, confusion, delirium, and impaired consciousness. EEG studies suggested the disruption of electrical activity in the frontal lobes of the brain. The study identified diffuse slowing in background electric activity in the whole brain in 70% of the patients. So unfortunately, COVID, not being a flu, very adverse, very damaging to the brain, and most commonly the frontal part of the brain. There was a lot of conversation about COVID and aspirin use. Don't take it, this and that. And now I'm not a proponent of NSAIDs. Aspirin is an NSAID. It's a non-steroid anti-inflammatory. I'm not a big proponent of using aspirin. However, this new study in October of 21st of anesthesia and analgesia basically said aspirin may be associated with improved outcomes in hospitalized COVID-19 patients. In 412 patients, 314 didn't receive aspirin. 98 received aspirin within 24 hours or 7 days prior to admission. The results were interesting. When you compare the aspirin versus the non-aspirin users, it was about a 10% difference that the aspirin users were less common or less going to, you won't see the 10% decrease on them getting mechanical ventilation. Whereas about a 13% difference between aspirin and non-aspirin users in ICU admission. So the aspirin actually helps. So the new study is, even though I'm not an aspirin user or a purporter of aspirin, it definitely helped. COVID-19 also increased the incidence of tinnitus. Tinnitus is the perception of noise in the ear and in the head. It's actually been exacerbated by COVID-19. In over 3,100 participants in 48 countries, 40% of those displaying COVID-19 symptoms simultaneously experienced worsening tinnitus, or tinnitus, however you want to pronounce it. Air pollution and COVID-19. Now, we've talked about air pollution in many of our lives before. Air pollution is very damaging to your overall health. It was an interesting conversation. My wife and I were in a city and we wanted to eat outside. But in the city, in New York City, unfortunately, look what's going on. In the city, you're seeing people sit outside, like not in the street, but in the where the cars go. It's not on the sidewalk. It's actually in, oh my God, the word is escaping me. Nevertheless, it's in the street, if you will. And my wife and I look at each other and we're like, well, is there social distance when we're there and this and that? But look at the air pollution. Look at the exhaust. So, I mean, if, COVID doesn't get you and make you ill, the air pollution certainly will. This study really exemplified that. 15% deaths worldwide from COVID-19 could be attributed to a long-term exposure to air pollution. It was 19% in Europe, 17% in North America, and 27% in East Asia. Melatonin. Multiple studies have spoke about a positive effect melatonin has. As a matter of fact, when the president got COVID-19, he was also administered melatonin. This was a Cleveland Clinic-led study. Melatonin is associated with 30% reduced likelihood of testing positive for SARS-CoV-2. Say that again. This was a Cleveland Clinic study that was just released, that melatonin was associated with a 30% reduced likelihood of testing positive for SARS-CoV-2. The reduced likelihood was 52% in African Americans. Don't know why. That was only the data that they shared. One of the other things that they gave the president when he had COVID-19 was vitamin D3. So let's talk about vitamin D3 status and COVID-19. COVID-19 patients, 82% of hospitalized patients had a vitamin D deficiency. So before we go any further, vitamin D3 with K2 is a choice. In 216 patients, 197 of those patients lived in the same geographic area, of similar age and sex. 47% were vitamin D deficient. Bottom line, here's the gem. Vitamin D may be the best thing you could do naturally to help you with your immune system in relation to some new data with COVID-19. Some of the things that I would recommend with COVID-19, or better yet, some of the things I would recommend for immune support, i.e. immune resilience, D3 with K2, melatonin, zinc, PEA, pro-resolving mediators, mushrooms, a panacea of different mushrooms, good, healthy diet, keep your stress down, get some good sleep, avoid carbohydrates. Please DM me or put at the bottom and let me know what you want me to talk about. Also, please like, share, comment this. It's always my pleasure. I do these all because of you guys asking for a request. So when you ask for a request, I'm happy to come out. Hope to see you guys soon. Dr. Rob, always yours in health.